It's my great pleasure to welcome our first speaker, Dr. Aishworiya from National University Hospital. She's a developmental behavioral pediatrician and a consultant at the Child Development Unit, Khoo Teck Puat National University Children's Medical Institute. She completed her fellowship training at the UC Davis Mind Institute in USA and is very passionate about research in autism, including screening and outcomes. She's also a member, together with me, in the Pediatric Ethics and Advocacy Committee at the National University Hospital. So we'll have her on the podium now to give us a talk.
Hi, good morning, everyone. Thank you for the opportunity to be speaking here, and it's a pleasure to be here today. This is a complex topic. I'm going to do my best to try to keep within 15 minutes. I have no relevant conflicts of interest to disclose. I do not have any shares in any genetic testing companies. So let me start this session today by drawing an imaginary patient for you, Elijah, who is now 21 months old. Elijah is a happy child. He largely plays on his own at home. He's able to walk and run independently, and he scribbles with a pencil. He does not speak any words yet, and he may not always understand instructions. His parents have also noted that he does not always respond to his name and has inconsistent eye contact. Elijah is the only child to his parents, who are both working. They come from a middle-class household, and they are seen as a subsidized patient. So in Singapore, there are two major types of patients in terms of their healthcare costs incurred. Subsidized patients are those who avail healthcare within the public sector, and they typically only pay a small proportion of the financial cost. Versus private patients are those who pay for their treatment costs in full and can seek care in the public or private sector. So typically within the public sector, the majority of patients we see are subsidized patients. So Elijah is referred to his developmental pediatrician, who diagnoses him to be on the autism spectrum. He's recommended to start autism-specific behavioral therapy, and this is going to cost a family about $1,000 to $2,000 every month, and he'll likely need this therapy for at least another 2 to 3 years, if not longer. His physician also discusses and offers genetic testing to his parents. They would like to have this done, but they are unable to afford it, as they will have to pay the cost of $7,000 in full, and so they decline. So this brings us to the premise for this talk. Who should be covering the cost of genetic testing in a patient like Elijah? Is it the society's responsibility? Now let's take a brief look at what is autism before we answer that question in detail. As many of you might know, autism is a neurodevelopmental disorder which is characterized by difficulties in social communication and restricted and repetitive behaviors. Autism can also impact several other areas of development, and it's known for its marked heterogeneity in the clinical phenotype. So individuals can either have severe deficits in multiple areas and so have intellectual disability and often restricted functioning, or they can have just mild differences in learning and processing and be gainfully employed and cognitively normal individuals. And that marks one of the challenges in considering autism as a single condition as well. We know that the prevalence of autism is increasing worldwide, and really the purpose of this slide is just to illustrate that it's not an uncommon condition. The median prevalence is 1%, and this is estimated to be the case in Singapore as well. So what causes autism? The current theory is that autism is a combination of existing genetic vulnerability together with certain environmental risk factors. These lead to altered brain pathways and subsequently to either autism itself or a broad autism phenotype. The key here is that it's a multifactorial cause with the interplay of various factors. We heard a little bit about this earlier in Dr. Chan's talk as well when talking about pediatric oncology. So we do know, though, that autism has a strong genetic component. It has been established that the chance of having another child who is on the autism spectrum is 10 to 20% higher if parents have a first child with autism. Several autism risk genes have also been identified, and each of these are associated with a higher likelihood of autism, although individually, each gene only accounts for a very small proportion of cases. So such gene mutations include those responsible for single gene disorders such as Fragile X syndrome as well as point mutations, which can either be inherited from parents or occur spontaneously in the child. So, given this knowledge, genetic testing for autism is a rapidly evolving field, with many countries actually recommending this as part of standard care for autism. Shown here are just some of the different genetic tests available. On the left is specific testing for certain conditions, such as Fragile X syndrome, which tends to be cheaper, while on the right is tests like whole exome and whole genome sequencing, which is increasingly the preferred test because of their higher diagnostic yield. Of note, however, even on a whole genome sequencing, the diagnostic yield is not 100%, meaning at best, there's a 40% chance of actually finding a specific autism risk gene variant that is associated with the child's autism. And the cost of a WGS with a chromosomal microarray included is about $7,000 for a child and his or her parents. And this is to be considered a miss against the national median monthly household income in Singapore, so it's actually almost double the cost. And further, this cost is the same for both private as well as subsidized patients. So meaning whether you're a subsidized patient availing healthcare subsidies or not, you would still pay this cost stated here. A clinician can apply for specific financial aid in those from especially financial needy families to cover the cost of this genetic testing, but this is typically only applies with stringent criteria, and the typical middle-class household was not going to be able to avail these additional subsidies. So the majority of patients end up declining a genetic test simply because of the cost. So this does brings us to the question, does the state or society have an ethical responsibility to facilitate access to genetic testing for all those who wish to have it done? And let's look at this from the core ethical principles. So first, looking at beneficence and from the point of view of the child, the parents, and society. So the direct benefit to the child would be the identification of a genetic variant that leads to the diagnosis of an underlying syndrome or associated medical condition with autism, and such a diagnosis can directly influence investigations and management appropriate to the underlying syndrome. So example of such conditions would include Fragile X syndrome, Rett syndrome, as well as tuberous sclerosis. However, such a scenario would only apply to the minority who will actually have what we call syndromic autism. Another point to note is that typically each of these syndromes present with other clinical features that are unique to these syndromes itself. So the chances of finding something like this in a child with autism with no other clinical features is low. Now, another possible benefit could be that of achieving diagnostic clarity in a child with an atypical or complex presentation of developmental difficulties. So in such a child, identification of a specific genetic variant known to be associated with autism can then establish the diagnosis and potentially explain related medical conditions as well. And this could potentially benefit a child by facilitating the use of appropriate medications. But again, such a scenario would only apply for a small minority of children. So really, at present, for the vast majority of children with non-syndromic autism, the results of genetic testing are unlikely to actually impact the direct clinical management of the child. Now let's shift gears and look at it from the parent's perspective. So I think from the parent's perspective, the main benefit is that of procreative beneficence, whereby results of genetic testing can inform the recurrence likelihood prediction for future pregnancies for parents. We already know that the generic increased likelihood is 10 to 20% for having future children if you already have one child with autism, but this may change and become higher if a specific autism risk gene is identified in the child as well as their parents. So this can thus enable a better informed decision making for parents as to whether to have more children. However, caveats exist here as well. First, given the multifactorial nature of autism, having a genetic susceptibility does not always translate to the actual presence of autism itself. It's only a likelihood at the end of the day. And secondly, again, genetic susceptibility does not predict the autistic phenotype, meaning how significant the difficulties might be, even if the child is on the autism spectrum. Now, another potential benefit for parents is that if parents do go on to have another child with autism, by knowing that this second child may be at higher likelihood for the condition, one can have closer developmental surveillance and theoretically on-time treatment if the child does show features of autism. And this can then potentially lead to better outcomes and functioning for the sibling and indirectly benefit the first child as well as the parents. So let's look at this study, which actually talked about, asked parents' views on what they think about genetic testing. So the study was conducted in Norway in a large sample of children of parents who already had a child on the autism spectrum. And you would note that the vast majority of parents actually wanted to do genetic testing if it would help explain the cause for their child's autism. So this was actually important to them. And a substantial 40% also said that they would do a genetic test if it would give them the possibility to prevent having more children with autism. So, certainly this study was from a Western country and there's a need for local and regional data on parents' perspective, but this might give us clues as to the priorities that parents place on the importance of genetic testing. Finally, from the society point of view, we know that the lifetime cost of supporting an individual with autism is estimated to be US dollars 1.4 million over the lifetime. And this further increases to 2.4 million in the presence of intellectual disability, which is not uncommon in autism. Thus, facilitating genetic testing can potentially reduce disease burden to society through enabling parental informed decision-making and on-time autism treatment for future siblings. Another important benefit would be that it can contribute towards the scientific knowledge of autism, which is still a relatively young condition that we are learning a lot about. So building up a repertoire of genomic data of autistic individuals can actually aid towards understanding the condition better and potentially contribute to future advances in treatment. So this could be a benefit from a societal point of view. Going on to non-maleficence or not doing harm. So again, from the child perspective, I think in the majority, one can argue that genetic testing is an unnecessary process with no direct impact on the care received. In addition, there are procedure-related impacts, including venipuncture and associated pain and trauma from it, as most genetic testing are still blood-based, although there are buccal tests coming up as well. There are, as we've heard in the previous talks, there might be implications for insurance coverage in terms of having a specific genetic variant, and so potentially lead to discrimination. And lastly, there is the risk for other incidental findings found on whole genome sequencing, as we discussed as well. From a parent's perspective, a test showing that a child inherited a disease-causing gene from the parent may induce feelings of guilt and anxiety, and this can cause family conflicts as well. There is also a definite chance of there being a non-determination of cause given the diagnostic yield of genetic testing. And lastly, if parents go on to have a subsequent child who's at higher likelihood of autism, this knowledge may be an unnecessary burden to parents. Having to do heightened developmental surveillance may also be a financial burden in addition to supporting the index child. And some have also argued that it may have an adverse impact on the parent-child relationship for the subsequent child if parents knew that he or she was at higher likelihood of autism. Harms from a societal perspective would really be the cost of genetic testing. So if society were to cover it, based on some estimated calculations, this would be about $1 million per year, assuming 35,000 babies born in Singapore per year, and only a subset actually even wanting genetic testing. There is also a duty on the healthcare system to be able to provide on-time treatment for these siblings who have been identified to be at higher likelihood following genetic testing. And this may well lead to additional strain on already stretched resources for interventions for all children with autism. Looking at autonomy next. So in the pediatric context, especially in the context of young children, one would argue that parents have the autonomy to make this decision, as they will be the ones taking care of the child, and they have the right to hence be informed of the recurrence likelihood. And this decision would have a direct impact on their own well-being and that of their existing children as well. The parental burden of caring for a child with severe autism can indeed be very high, as illustrated by this unfortunate case in Singapore recently. A father strangled both his 11-year-old twin sons with severe autism so as to relieve them of their burden and relieve himself as well. And this case really shone a harsh spotlight on the daily struggles faced by many of such parents and highlights the need to empower them in whichever way possible for future informed decision making. Lastly, from a distributive justice perspective, one can argue that every healthcare system should be able to provide genetic testing for autism, and this would include being able to offer the test either via local laboratories or international ones, having the operational processes in place to facilitate that, and having trained professionals to counsel parents before and after test. Making genetic testing available for all those who would value the information that the results will provide will definitely be in the greater public interest, as we discussed earlier, and it will also be in the principles of equity to ensure access for all. Lastly, a brief mention about neurodiversity, although this is a topic by itself really. This growing movement over the last decade alludes to the fact that in many individuals, autism is a difference and not a disability or a condition to be eradicated. And such advocates question if parents or anyone have the right to decide on the value of an autistic life, and also fear that preemptive intervention for autism may devalue the autistic identity. What is also clear is that existing literature is heavily focused and conducted by non-autistics, so there has been minimal participatory research capturing the beliefs of the community adequately. So in conclusion, I think this is a difficult question to answer with multiple considerations. There is an urgent need for participatory research to include views of the autistic community as well as parents from culturally diverse families. But one can argue that in sum, if we were to prioritize the benefits to parents and the potential remote benefits to the child, genetic testing should be made available to all those who need to have that information. And this will likely only apply to a subset of parents who wish to be better informed. Meanwhile, while we work on making that happen on the ground, it is the clinician's responsibility to advocate for genetic testing to be done and arrange for financial aid where needed, especially for children with syndromic and complex autism, such as children with dysmorphic features, specific clinical features of an associated syndrome, associated comorbidities, as well as a strong family history of autism or intellectual disability. It is also important to revisit genetic testing later on in the patient's long journey, as this is a rapidly evolving field and the cost of genetic testing may well come down, and there is a potential for direct impact on clinical management of the child in future. Thank you very much for your attention.